but certainly many of the issues we've covered today, there's a layer of complexity that I feel we tend to lose, and gets glossed over. Much as I love social media and I worked for a social media company and I get a lot of joy out of looking at Insta posts talking about mental health nowadays, but I do realize, unfortunately, it tends to also simplify, right? Because the way the algo works is both of us are going to get posts on grief for sure after posting this grief and loss. Some of them are lovely and beautiful and moving and helpful, but I want to ask about the flip side, because I think sometimes what ends up happening is we see these very sanitized kind of curated posts and we feel like we should also be clipping along, or we have that anxiety that grows because we're not at the same place that someone else is, or we're not able to catch up. What are your thoughts broadly on social media, young mental health specifically, but also around this kind of anxiety that it's kind of creating or causing?
Yeah. I think that one of the most disturbing trends, there are 2, 3 disturbing sort of losses of nuance that I notice. And one is this trend towards over labeling, over diagnosis, to saying everyone is depressed, everyone has anxiety, everyone has trauma, everyone's got ADHD, everyone's got autism. And I think this is something that we started noticing happening with the pandemic, with TikTok, and young people self identifying with diagnosis. I think that became sort of a little bit of a challenge, and there's nuance that's lost there, because we are now kind of just able to Google, see symptoms, and say, okay, this is me, that's it, I have it. So the fact that mental health exists on a spectrum, and one end of the spectrum may be a disorder, a diagnosis, or pathology, or however you want to kind of politically or theoretically conceptualize it. But mental health is a spectrum, and I think that nuance of that spectrum, that all of us can be at different points in that spectrum at different points in our lives, is a nuance that gets lost. So there's this huge burst of popularity with diagnostic labels, and I think that's one worrying nuance, and I would caution people against that. The second loss of nuance, I think, is in the vocabulary around healing. That healing can happen in bullet points, that healing can happen in 5 must do's to make sure that you are cured of whatever. The other danger, I think, with social media is that you have no way to vet the information and the source information. So you have these healers and coaches and inner child healers, and I think there's all sorts of new categories that are bursting forth, and you may not be able to kind of really figure out. There's no way for social media to gatekeep the information that is coming to you. So the information you might be getting might be coming through an absolute charlatan, untrained, very harmful sort of way of approaching mental health. So treat the information that you get with a piece of salt, with a pinch of salt, because you don't know where it's coming from, who's giving out the information. I also want to acknowledge, though, at the other side, that information from clinical experts is not the only legitimate form of information. I don't mean to say that clinical expertise is the only truth or the only valid form of knowledge. I think that lived experience knowledge equally deserves to be amplified, have a seat at the table, and maybe even disrupt the mainstream narrative around it. But if there's anyone who's telling you that they have a 3-session formula to fix your anxiety, or a 4-session formula to fix your depression, or treat your ADHD, life is messy, life is complex, mental health is messy and complex. There is no listicle, there are no bullet points, there is no recipe as such. It is a process, and it's a process that not only mental health professionals have access over. So I think one of the worrying sort of trends I see is that mental health is now seen as a repository, or a hold only of mental health professionals. But I think mental health, before it became mental health, uh, belonged to philosophy, belonged to literature, belonged to music. It's part of the human condition. So your therapist is one source of information, avenue, knowledge, and Insta therapists are one source, and that language is one way of understanding what's happening to you. But please go out and allow yourself to be, I think, allow yourself to have a richer vocabulary around mental health.